Christina Coulter. I currently practice at Minor and James in internal medicine. I graduated from the University of Washington School of Nursing program in older adult nurse practitioner track with my master's degree in March of 2011 and began working shortly thereafter. Prior to graduation, I already had 3 job offers, and I selected the one that I thought would give me the broadest experience and allow me to learn and grow those skills that I gained here at the UW. So I chose the University of Washington first and foremost because of the reputation, but also specifically because the adult nurse practitioner program incorporates older adults and gerontologic content into that track. I think that the School of Nursing sees that most healthcare we provide, older adults are a huge part of that. Over 50% of people admitted to the hospital are over the age of 65. And personally, on a daily basis, on any given day, probably 70% of the patients I see are over the age of 65. I also chose the School of Nursing because there's a wide variety of faculty members that have gerontologic interests and do research in that area and specialize in that area. So I felt like I would have a group of faculty members to guide my education that way. Additionally, preparation-wise, there were a large number of clinical sites that I could choose from that would provide me with experience with older adults, anywhere from in the skilled nursing facilities to assisted living to in the home to in the clinic. So that was a major factor. So when I started looking at doing my master's thesis or project for the program requirements, I happened to be a research assistant with Dr. Linda Terry's research group. And was talking with her about opportunities in dementia care and interventions for older adults. I chose a topic that was closely related to that. I knew I wanted to do something with older adults and with dementia, so that provided the perfect opportunity. There were a lot of different faculty that I could work with and different options, and that was what piqued my interest, and Dr. Terry was very supportive, so that was helpful. And there was a lot of data to work with. So I was able to find a topic that fit my interests and ended up being quite successful. My project was a qualitative analysis of video data that we had with direct care workers who work with patients with dementia in assisted living residences. I looked at the responses that the direct care workers gave after viewing video scenarios with interactions with people with dementia, and we gathered a fair amount of information that in the end will help us guide interventions and trainings for those individuals who do work with people with dementia on a daily basis and how to best improve the care that they're provided, reducing hopefully depression and anxiety in residents with dementia. I presented the work at the Gerontological Society of America's National Scientific Conference in 2011, as well as the National Gerontologic Nurses Association Scientific Conference in 2011. One of the best things about the program here at the University of Washington School of Nursing, I think, is the faculty. They're all very supportive and very welcoming, very open. I've felt like I could go into anybody's office, knock on the door and ask a question, email anybody to ask a question or request guidance in some way. All of the faculty are here to help facilitate learning. That's everybody's goal, and that's very evident in their interactions with students.